Hi, everyone. Welcome to the weekly training and happy to see you again tonight. Despite medical advancement, we are still not improving in the area of metabolic health. Many countries are still struggling with, issue of overweight, high sugar, and high cholesterol problems. Do you know, until today, 50% of Malaysians have high cholesterol and overweight. Unicity, as a pioneer of the metabolic health company, the BioLife range have proven to be more important as ever. With what we have right now, how can we cut this problem effectively? Let's learn with new perspective. Over to you, Claudia.
Thank you, CK, for the introduction, and good evening, everyone. It's great to see all of you here again. And as always, we really appreciate your time spending with us today. So I think time has passed very quickly. We're already entering the middle part of the year. And today's topic, okay, let me just share my screen shortly. Okay, so today's topic is actually a very, very important topic. All right, it's not just only something that is very close to the mission of our company, okay, which is to make life better, but it's also something that all of us can relate to. Yeah, I'm sure everyone has a friend or a close loved one who are struggling with issues of metabolic health. And you may be, one of those people who are also trying to find solutions, okay, to overcome this problem. Because truthfully, even though, like what CK have said, all right, we have progressed tremendously in the area of technology, of medical, all kinds of things, but really we are still stuck, okay, in the area of health and nutrition. Okay, if anything at all, we are getting worse in this trajectory. So today is a very important topic, and even though it's something that many people are aware already, but it's good to still know what are the latest advancements in this area. And I believe that today's presentation will be beneficial to many people. So before we start, here's a quick disclaimer, all right? Okay, so I just want to start off with this question. Are you healthy? So for some people, this may be a very sudden question, all right, that's presented to you out of the blue. What do you mean that I'm healthy or not? Well, if you ask most people around you, they will say that they are healthy, okay, because I can still eat like normal, I can still cook like normal, all right? I can still spend time with my family, I can still sleep, all right? I'm sleeping very well. And yeah, because of these reasons, I don't feel anything, so I'm healthy. And people would rarely tell you that they are not healthy, okay, unless they are already diagnosed with a very severe disease, then they would say, oh, okay, I'm not. So then how can we really define a person to say that they're healthy or not? Because if you base on your feeling, well, it's not an accurate description, right? So most people would want to find out this question, this answer by taking a blood check. Okay, they will do a blood report to identify where they are. So HbA1c less than 6.5. Okay, this is basically an indicator to identify your blood sugar for 3 months. Okay, there's total cholesterol, there's LDL, and so on and so forth. Okay. But with all these indicators in our blood report, are they truly an accurate depiction, all right? Do they paint an accurate picture of our state of health? So just for your reference, okay, if you have HbA1c more than 6.4 means you're diabetes. And if you are like in the middle, 5.7 to 6.4 means you're borderline. Okay, we classify this as pre-diabetes. So scientists has actually tried to dig further, beyond than just numbers, okay? Because all these things are just numbers, right? So according to the latest research from the American College of Cardiology, okay, they wanted to identify what are the risk factor, okay, if individuals have normal blood sugar level, okay, because there's a cutoff, right? If you're above this, you are at risk of this. But they wanted to find out further if a person, okay, have HbA1c less than 5.7, where does this put a person, okay, in terms of their metabolic health? So through this study, okay, they have recruited 4,000 people. And from there, they wanted to take a sample size that has either individual with has pre-diabetes, right, borderline, not yet diabetes, or normal sugar level. And also, they wanted to streamline to find out if there's any existing condition. So for this case, no, all right, the population here are relatively healthy. Okay, they don't have any symptoms. So they find that individuals who have HbA1c 6.1 to 6.4 are classified as pre-diabetes. So, of course, all right, individuals who are in this range are at a higher risk of getting cardiovascular disease. So this isn't very surprising. But what was surprising was, okay, individuals who have HbA1c lower than the pre-diabetes range are actually found to be statistically significant, okay, in terms of their risk increase towards getting cardiovascular disease, okay, things like heart attack, arteriosclerosis, and things like that. So they found that people who are even at a normal level of HbA1c are at increased risk of all these factors. So what does this mean? And what does this study tell us? Well, just because a disease has a certain cutoff and you are a digit below it does not mean that you're perfectly fine. And no disease doesn't mean that you are healthy. Just to share with you something that happened recently. Okay, a good friend of mine that I know has always been very healthy. Okay, she has always cooked her own meals. She always prepare her own food, and I mean, she indulged here and there a little bit, but she has relatively tried to control her own lifestyle. Okay, and 2 years ago, she took her blood report. Everything looks perfect. Okay, in terms of sugar and everything, it's okay, So just only, I think she took a blood reading, was only just this month. Okay, she took a blood reading, and to our utter surprise and shock, her blood reading went haywire. All right, like everything that you can imagine. Okay, high cholesterol, her blood pressure was so high, it was 200, and I can't remember the figure behind, but it was pretty high. And then you can even identify white blood cell in her bloodstream. Okay, this means that there is a certain degree of arteriosclerosis already. It means her blood vessel may have already been inflamed and there may be a plaque. So how can a person who is feeling perfectly fine, all right, with no symptoms, no nothing, can suddenly 2 years later have all these metabolic things that we've been talking about just now? So what you see in the report 2 years ago or even now, all right, if doctor were to say 5.5, 5.6, okay, if your HbA1c, you don't have to worry, right? Because you're in the safe zone. But that is not necessarily true, In fact, you still have to take care and you have to take it seriously. Because this is where people will tend to let loose and don't care and just do whatever. Oh, because doctors say I'm fine, so I can abandon whatever restraint I have and just indulge. So this is what happened to my friend. Okay, it's quite a surprising thing to me. And okay, so this study, as I continue reading, they wanted to find out on ways to overcome this issue. So they have listed out a whole conclusion. Okay, they listed out extensively on how medication is effective. Okay, in overcoming these metabolic problems. They talk about, oh, diabetes have this drug, and cholesterol has this drug to this. And they only have one sentence, okay? Only one sentence that touch on lifestyle. So what does this tell you? This really is a reflection of our medical culture, that everyone is going with medication first, all right? If this one is like that, doctor will straight away give you medication and you'll be on it for the rest of your life. But of course, we're not saying that medication is not important. Well, of course, there are some people who may not be able to modify this sugar or cholesterol issue without medication. But with the way they emphasize it in their studies, I don't think that is really the reality. Because truthfully, we are not eating all this medication every day, by right. Okay, what really leads us to diabetes or high cholesterol is the food we eat every day, right? It's the type of food we eat, the nutrition. Are we having enough nutrients? The sleep we have, the quality of sleep, stress levels, emotional stress, mental stress, and exercise. These are factors that we do every day that will eventually lead us to either having diabetes or high cholesterol. But it's not the drug. And in fact, medication should only be the last resort. Should only be the last sentence, okay, if all these things don't work, then you have to take medication. So in fact, this is what we should be looking at, not the other way around, which is what, the medical field is trying to push the population. So with all these things that we talked about extensively, it's high time that we have to set better goals. It's not about how close we are going to approach a disease or whether we feel anything or not. As you say, my friend, she can do everything just fine. She can cook and she can laugh as normal, but she doesn't know, okay, that she has all these kind of high cholesterol, all these things going on. So we have to make sure that that we have to maintain healthy with real lasting metabolic change in our life. And this should be our target and not about not having any symptoms of disease. So talking about all that, all right, this is where the 3 core bios plays a very, very important role. Okay, even though it has a history of 20 years, but it is still very relevant today. So we target things like, okay, Biosaf C+, okay, C7. So we will go with the first one first, all right, Biosaf C+. So 4 in 10 individuals have high cholesterol issues. And now I think it's already more than that, it's already half of the population. So here is a graph, okay, that describes the percentage of cholesterol with age. So if you can see here, percentage is, okay, is here at the vertical one. So at the bottom is age group. So we can see here, it's very obvious that it's an increased trend of cholesterol levels, right? So orange is the group of people who have diagnosed high cholesterol. But the blue one are groups of people who are unaware that they have any indication of high cholesterol. As you can see here, it's a very high percentage, it's a 32, 33, and it's more than those who are diagnosed, And only you see when they are approaching 60 years old, maybe they go and take their health more seriously. So the high cholesterol people who knows about their status increase. But you can see actually a big portion of people really don't know that they have high cholesterol issue. Okay, it's a big percentage here. Okay, and 80% of people who have high cholesterol who are diagnosed are on medication. Okay, and sad to say, a lot of them have to depend on it for the long term. Okay, in fact, high cholesterol has become so serious that now current guidelines are, all right, worldwide are recommending children to have their cholesterol levels checked, All right, never before I thought that this is a recommendation, okay? It looks like they are now even targeting on children because they are also becoming a high-risk group. So ages 9 to 11, all right, I recommended to take once. And then the next blood test would be 17 to 21. So as you can see here, high cholesterol really is a very prevalent problem, and it's even happening to our children and our kids. So why is cholesterol such a huge problem and such a difficult problem to overcome? Well, there are two big roadblocks. One is the food, and secondly is the body and the area of production. So our body produces up to 80% of cholesterol, right? In the past, it used to be 70 and 75, but now Harvard is stating it's 80%. Okay, it's a lot in our body. Okay, so why? Because our body keep producing a lot of cholesterol, right? And over time, it starts to become a problem. Some people will naturally produce more cholesterol, okay, because they have too much of this cholesterol producing enzyme. So the body just keep on producing cholesterol. And the body can't keep up, right? So it will eventually lack the ability to remove excess cholesterol. Okay, there's too many incoming cholesterol already. So over time, our body will not be sensitive to high level of LDL, and this vicious cycle will then repeat. The body will produce even more, it can't remove, and that's how high cholesterol happens. So how can we tackle this issue, as overproduction is such a big problem? So the first method is we have to target the liver. Okay, this is the central hub in which cholesterol is being produced. So liver, when combined with cholesterol enzyme, this is where cholesterol will be produced. So BioLife C+ have this active ingredient known as polycosanol. So this polycosanol helps to inhibit this cholesterol enzyme. So when this is inhibited, cholesterol then cannot be produced. So this is where cholesterol will be reduced in the body. So just to let you know, statin drugs also use this pathway, right? But the only downside is that it will stay in the body. So we do not know what are the long-term effects of it, and it will leave behind residue. So for supplement to give us this effect as of part with drugs, I think it is very good. Secondly, we move to another key organ, okay, which is the intestine. So food will pass through our small intestine for absorption, right? And in our intestine, there's this receptor. So this receptor, when bind with cholesterol, okay, this is how cholesterol will then be absorbed and produced in the body. So BioLife C+ can also tackle this by introducing plant sterol. So as we can see in this picture, plant sterol and cholesterol, their shape is very similar. So the receptor will think that, oh, this is cholesterol, so it will then absorb this plant cholesterol, leaving excess cholesterol behind. So then all this cholesterol will not be absorbed and it will be removed from the body. So even though food is only 20%, some people might think, oh, if that's the case, then I can just eat whatever I want, right? But that's not the case. Because every 200 milligram of cholesterol that we consume from food, and this is just one egg yolk, it will stimulate our body to produce 800 milligrams of cholesterol in response to this food intake. So I'm sure we eat more than just an egg yolk, right? We eat a lot of food that has cholesterol in a day. So you'll be producing way more than 800 milligrams. So because of this reason, all the more we have to also pay attention to the food that we take and what can we do to also counter this problem. So to tackle incoming food, all right, we have the third method in which we will remove cholesterol from the food. So whenever we ingest food that has high cholesterol levels, all right, the 6 types of fiber present in BioLife C+ will then bind with this bad cholesterol. So once it is being bind together, it cannot be absorbed in the body. So it will then be expelled and removed away from the body. So this is how it targets that. And also, you still have the fourth method, all right? It can also help to lower cholesterol and LDL, with having chrysanthemum. So this also has chrysanthemum. And what chrysanthemum does is that it will convert cholesterol to other useful components into the body, right? Things like a hormone, right? And other functions. And it will not accumulate so much cholesterol in the body. So because of this reason, our body cholesterol level will be reduced significantly, and it will also help to remove the LDL from the body as well. So to be honest, okay, for a supplement that can give us such an extensive, okay, 4-step method to lower cholesterol, it is very, very impressive, all right? And it's so much so that we have also enlisted the effects of Bioslife C in our research paper. Okay, this is actually a pretty recent one that talks about how effective Bioslife C is. So in summary, okay, how does Bioslife C work? So it gives us a very comprehensive 2-in-1 protection by firstly tackling production in the body and 2 main organs. One is the liver and the other one is the small intestine. Then when it comes about incoming food, right, Bioslife C Plus also tackles by removing excess cholesterol, removing them from the body, and lowering the cholesterol and LDL levels. And the best thing is that it's more than just a fiber supplement, okay? And it is safe without any side effects. So this is really, really an awesome product. Okay, so you have tackled one of the big 3, cholesterol. So next, we want to go into Bioslife S. So Singapore, all right, overweight is 36%. But Malaysia, we are leading, all right? We are 50%, okay, meaning to say that half of the population are struggling with overweight issues. So how does overweight happen? All right, is that because of our diet, right? Our Asian diet, we eat a lot of carbohydrate food like rice and noodles. So after eating this for years and years, our insulin level has always become high, okay, because it will be increased when we eat high sugar food. So what happens is that when insulin increase, this is our fat cell, all right? Sugar will then be stored in the fat cell. So it will just keep accumulating, you just keep on accumulating. So over time, even if we don't eat food that has carbohydrate, okay, if we don't eat like a high starch food, our insulin level will still be high, all right? For no reason also it can become high. So when this happens, our fat cell will one day have too much of sugar molecules inside. Okay, we have too much, so it becomes very big. So when that happens, the fat cell will divide, okay, to split into 2 fat cells. So the cycle will continue, all right, because insulin level will always become high. So the whole process of sugar accumulating into the fat cell will then repeat and will happen again. And if you put that for 2-3 years, and if nothing is done, then your fat cell will multiply to even more fat cell. And just to share with you this news, okay, our fat cell will not disappear. The size will only keep increasing, and you will keep splitting to more new fat cells, and you only increase. And the only way we can tackle this is to make sure that they don't divide anymore, all right, and become small. So Bioslife S, all right, the fiber matrix, okay, it's so powerful, right? It's able to lower the insulin level. So this is really the key here, right? Once this insulin level is low, this sugar that's been stored in these fat cells have the opportunity to be mobilized. So it's able to come out from it and then be burned, all right, and be used. So when we use this Bioslife S, okay, for a sustained period of time, we're able to do it long enough, the fat cell will then, the sugar will be emptied out and the fat cell will be shrink. Okay, and this is how a person can lose weight with Bowels Life S. It helps us to maintain the small fat cell, right? And on top of that, okay, about controlling our weight loss, okay, the carbohydrate food that we eat, all right, like for example, chicken rice, the fiber matrix in Bowels Life S, all right, it's very similar to a sugar molecule. So it's able to bind together with it, all right, and then similarly, it will then remove this excess sugar away from the body. So this is how we can also lower sugar levels in the body. So here is a research study that is conducted in the University of Sydney, okay, to identify the effectiveness of S. So as you can see here, the sharpest graph here is actually sugar, all right? And if we just take one dose of Bowels Life S, we can see a very significant decrease of sugar level. So from here, it becomes here. And if we take 2 doses, all right, it can then lower even more drastically. And as you see across time, this has a very drastic drop, all right? But this, okay, with Bowels Life S, can then maintain at a very stable level. And another dangerous thing about just taking glucose alone, okay, if you take sugar alone, it will then exceed the normal levels of sugar, okay, when it crashes. And this is where we get very, very hungry and we have the craving to eat even more sugar, and then it will spike up again once we do it. So this is a very effective graph, okay, of how Bowels Life S can help us to control our sugar levels. So Bowels Life Slim, all right, it's straight to the point, right? It's key to weight control. Why? Because the fibers help to lower insulin level, okay, and the structure of it is similar to sugar, help to bind it and remove it from the body. And best is it's safe without any harmful side effects. Okay, so as we go into weight loss and sugar, next we have another key component, okay, which is Bowels 7. So how does Bowels 7 help us? All right, this is not just any formulation. Okay, we have upgraded the fiber and we have included inulin. All right, to increase the viscosity of the fiber. All right, it can absorb water better, and also it has better fermentation properties. Why is that so important? Okay, because of this other key ingredient that we will introduce, which is known as the yeast fermentate. So this is not just any yeast that we take from the grocery store, right? This is some very special yeast, okay, that is known to exhibit very significant changes to the microbiome, okay, towards the good bacteria. So combining this yeast with the fiber and with the polyphenols, okay, so these polyphenols also have active ingredients to collectively help to benefit our good bacteria. So with the combination of these 3 key ingredients, all right, there is significant changes in our gut profile. So this is a clinical trial that we have done, all right, in a span of just 12 weeks. Okay, this is a very short amount of time, and individuals take Bowels 7 twice a day. So you can see this is the microbiome before taking the Bowels 7. And after taking the Bowels 7, you can see a very, very drastic difference. So before that is predominantly all bad bacteria and just a handful of good bacteria only. But after, all right, taking just twice a day, we can see that the bad bacteria has shrunk significantly, and not just only good bacteria increased, but the type of good bacteria, the diversity, all right, of the good bacteria has also significantly increased, up to 58 times, right? this is not just a small percentage, but this is a very drastic difference with some of the key ingredients that we have in BIOL-7. So this BIOL-7, okay, why is there so much development in the area of microbiome? Okay, and this the mechanism is very, very different from C+ and S. Why? Because good bacteria, all right, there's a lot of research that they are able to identify people who have metabolic issues that actually have a very poor gut health one. All right, many those that has weight issues, most of the time their gut is something wrong in there. So they find that this good bacteria, all right, with our BIOL-7, once it ferments in the body, it can then produce this thing called short chain fatty acid, which we call it SCFA. Right? This is not your not just any fatty acid. It has to be fermented with good bacteria. So what's so important about this? Okay, so once this SCFA increases in the body, all right, it can then help to increase the enzymatic activity in the liver and the muscle tissue. So what does this mean? This means that your liver and your muscle and the cells can metabolize sugar better. So if more sugar can be metabolized, right, it can be used more effectively in the body, then there will not be so much problem about excess sugar floating in the bloodstream. So when we have a significant amount of this SCFA, it can then lower sugar level. Okay, it can help to lower and balance our sugar level. And in some cases, it can even increase the sensitivity of our cells. Okay, because why some cells they have insulin resistance is because they are no longer sensitive to it. Okay, they reject insulin. So with this SCFA, okay, it can then open the receptor and it can be more sensitive towards metabolizing the sugar. So BIOL-7, by activating the microbiome, it can also exhibit this sugar lowering benefit. So this is a good side benefit when it comes to microbiome. So in conclusion, okay, these three core BIOS, right, they have three very different functions. So first, okay, BIOL-5 C+ is cholesterol, okay, followed by S is weight loss and sugar as well, actually. So BIOL-7 is microbiome and also some side benefit in the area of sugar control. So just to give everybody a summary, okay, of what we have discussed and for you to digest the points better. C+, okay, first of all, it controls cholesterol by tackling the liver production side and absorption at the small intestine. Okay, so when that is tackled, then it also tackles the food part. It removes excess cholesterol, okay, removing it away from the body, and it lowers cholesterol and total LDL levels. Next, we have BIOS-Life S. Okay, it lowers insulin levels, all right? Okay, and when the insulin level is lower, okay, our sugar can then be used, and it can also shrink the fat cell, and this is how it leads to weight loss. And it also helps to remove excess sugar. Last but not least, we have BIOS-7. So BIOS-7, okay, is a combination of the yeast fermentate, the fiber matrix, and the polyphenol from the fruits. So all these exhibit a very powerful effect on the microbiome, okay, as much as 58 times in terms of the microbiome diversity. And it also has some sugar lowering benefit. So this is a summary of our three core products. So I hope with this, you have a much more clearer picture of the function, all right, and the distinctive uniqueness of our three cores BIOS-Life. Even though it's been around for a long time, but it's still very, very important today. Okay, so for us to emphasize, all right, the effectiveness of our BIOS-Life range, we have two testimonials that will share with us their story, all right? They share with us their experience and their life-changing benefit with BIOS-Life. So firstly, I want to introduce Lai Yokwa. Okay, Yokwa, are you here? You can just unmute you and allow you to speak. Hi, Yokwa, are you here?
Hello, Claudia.
Hi. Oh, I can't see your video.
Okay.
Sorry.
I cannot start my video.
Oh, okay.
Can help to enable my another head MacBook, Yokwa head MacBook.
Yokwa MacBook. Okay. Give me a moment. Okay. Can someone in the admin please help to identify? Okay. This one, right?
Yes, Claudia.
Okay. Okay. All right. Good.
Good evening, everyone. My name is Yokwa. I'm from Kuala Lumpur, Malaysia. So I will share my experience in using the BioLite S. Okay. Next, Claudia. Okay. I'm 49 years old this year. And then back to 4 years ago, 2016, I have a long time I haven't have a blood test. Okay. So since after I left my college, after I go in job, so I never take any blood test for 20 years. Those in 2016, my friend accompanied me go to take a blood test. So I found out my result is not good. Later, Claudia will show you. Before that, for the more than 10 years of working experience, so I found I have every month I have a migraine. Every month come migraine. It's not like something a period, right? Women also facing. Every month I have a very bad migraine. I didn't notice that I have a fatty liver until I have a blood test. So from this photo, you can see that I have a big tummy also during that time. Okay, next. So every month, I go back to visit the medical center. Then doctor advised me to take supplement to lower down I have a cholesterol issue and also the liver problem. So you can see my cholesterol is 6.1 until, and then my LDL very high, triglyceride also very high. Every month I have to go back to check, monitor. So they advised me to use the supplement, but I resist to use it because myself, I didn't like to take supplement. I also not trust it. So I use my method. How? So I keep on practice Tai Chi. Because I am Tai Chi practitioner, I also teach Tai Chi, help my sifu to teach Tai Chi also. So I use my method. I thought that food wise, how? So I eat less and then I eat more vegetable, eat less meat. So I thought it's a healthy. But eventually it's not. Every month the result is very bad. Until July 2016, that day I found that I need to pay. I pay for myself for the blood test. So after that, I didn't care. I did not eat. So until my friend Samwing introduced to me this university business, only I realized that is this supplementation, is nutrition is very important. Then I take the challenge. I joined the metabolic program for 60 days. As you can see the next slide. Okay, in June 2017, I start using the BioLite this product and also to run the metabolic program for 2 months. Amazingly, I get my result in 2 months. Everything is go back to green. As you can see, my cholesterol 4.63, a lot of changes. And my triglyceride is very low. My LDL will low down. I am very happy because this BioLite S and the metabolic lipid program helped me a lot. And then I came back and my energy. I have an energy issue. So in this, when I practice Tai Chi, I play with people with pushing hand. I found that I have a lot of energy, very alertness, and I can handle very big size people. That's the advantage. You can see. And then I found that this my migraine and the fatty liver gone within 60 days. So very powerful. Thank you very much. This is my sharing.
Okay, thank you, Yokwa. Wow, it's a very, very powerful testimony. All right, for someone who has been struggling for many, many months, actually, okay, high cholesterol and all that, in just eating Bow's Life S, okay, for 1 month. Yeah, you can already see a difference, okay, and continuously until August, all the indicators have reduced. And even better, it even reduced the indicators for liver function. Okay, just so you know, liver function, those numbers don't drop down so easily. Yeah. So Bow's Life S can also bring these effects, and all these are hardcore data effects. So yeah, it's very powerful results, and I'm so glad that Yokwa, you have decided to share with us here today. Okay, it's great. Thank you very much. So next, we also have a very seasoned member with us, all right, to share with us his powerful story with Bow's Life. So let's welcome GC Ong, all right. So GC, are you here? Hi GC, can you open your video?
Hello.
Wait, sorry. Can someone, can you pin him? Okay, I can see you already. All right, great.
Yeah, I can see myself.
All right, good. Okay.
Okay, should I start?
Can, yeah.
Hi, everybody. Good evening. Thank you for the opportunity to share my story. I've been in business for a long time, and I'm a very strong product advocate of university. But unfortunately, in 2016, I was infected with a bacteria, and I was infected Staphylococcus aureus, and I had septic arthritis. I went for the acupuncture, and that led to cellulitis. So to cut things short, I had an emergency operation because I cannot walk, I cannot move, and after the operation, I was in the hospital for 1 full month, and I was given the antibiotic drip for 24 hours a day for a full month, and I was lying just in the hospital for 1 full month, and I lost my energy, and at the end of the 1 month, I found out that I lost 12 kilo of body mass and muscle, so I was like a shack, and I went through the progress of using the wheelchair, and then to the walker chair, and to the 4-pronged tongkat, and then finally to a walking stick. So that took me almost a period of 2 years. And along the journey, I took up Qigong and exercised and all that. And in 2019, I was told that I qualified for the convention in Korea. So I went to Korea, and what I saw stirred the interest in me, and I was introduced to the LC-based Unimate field, and also I came to know about the Bow's Life 7. So in my journey from 2016, where I was hospitalized, early 2019, I had another problem. I just went flat on the floor, and I could not get up. I was lying on the floor for 2 full weeks. My energy was at an all-time low. It was down to like 0 energy level. And so it was a big struggle for me. And when I was lying on the floor, my only dream was to be able to sit up, and that's it. So in the process, I had a faith in the university products. So I went on the Bio 7 for the full 3 months. And I find that I felt much better. And naturally, I went for a full 6 months of the Bow's Life 7. And I understood what microbiome can do for my body. Now, in the process, when I was in the hospital, I was told that I had high blood sugar, I had high blood pressure, my cholesterol was okay, but just I have high BP and I have high blood sugar, and I was put on medication for almost 2 years. But after completing my Bio 7, and I went on a serious exercise, and actually, frankly, I also took a lot of the protein drink by university, and in the process, I recovered. I got back my energy, I go back my power, and I go back my muscle. So it is amazing because my belief in the nutrition, I have a very strong belief in the university products. And so doggedly and diligently and consistently, I took the Bio7 every day. So this is my story. So from low energy to my recovery. And lastly, I want to conclude is that one should not boast about your health, but one should take pride in your health and be proud of your health, because anything can go wrong with your body, more so with an aging body. I'm now already 68, right? So, and that preventative measure, of course, is the best option. And I really would like to encourage all of you that not just to take the product, but to take the product consistently, and you will get a result. Thank you.
Thank you very much, GC. Okay, that is a very powerful testimonial. Okay, so just to sum things up, okay, he had a very, very serious bacterial infection, and that he had to be admitted into the emergency ward, okay, and that has rendered his health very badly. And after that, he has all the 3 highs, okay, all the metabolic problems, and he at one point he couldn't even breathe, all right, with indigestion problem. So he took Bio7, all right, consistently for 6 months, I think. So, and from there, he see tremendous change, all right, in his health and his metabolic indicators. So this is also a very, very strong testimony of how our BioSlife range can help, okay, more than just metabolic health. Can restore your energy, can even help you recover faster from whatever that you're struggling with. So thank you so much for staying with us, okay, and for listening to these 2 wonderful testimonial sharing. And now we are open to Q&A. Right, so this is the time that you can be, this is the time that you can ask whatever questions you want to know, all right, about this, and I will be more than happy to answer. Okay, let me see from beginning. Okay, from Steph. I too face the same problem, diet and Zumba for 2 weeks. I gained more weight. My sister introduced me Clear Start. Unfortunately, my handphone was stolen. Otherwise, I can show you my blood test result. Oh, that's great. Okay, it's great to know that you have also experienced beneficial effects with our products. Okay, hopefully you can get your phone back. Okay, other than blood tests, should we go for a DNA test? Okay, I know now there's this very trendy thing going on. It's called circular DNA. All right, and apparently you can identify your ancestor. Okay, you can even know your generation, you're from which country, where, or something like that. So to be honest, I'm a bit skeptical. Okay, I don't know how accurate are these DNA studies, all right, or are they just for you to know your ancestor? Okay, and what kind of information you will get from it? I'm still not very clear on that. So I think now it's still better to stick to more traditional means like a blood test. Okay. Okay. From Nash, can the Bio7 S and C plus taken at the same time, meaning before food, 10 minutes? Yeah, actually the best time to take these 3 products is before food, because if you want to absorb the incoming cholesterol or sugar from our food, okay, the fiber has to be there 10 minutes before. Okay, if not, you will not be able to remove the sugar from or the cholesterol from the food. Okay, all right. Is the fiber matrix similar in content and amount in all of our slide series? So thank you, JC, for this question. All right. Actually, they are different. Okay, the structure of it is different. So the composition of S, all right, is more similar to what's cholesterol. Okay, how it's able to bind to cholesterol more effectively. So there are some changes in the fiber matrix. So for S, you'll be more towards binding towards the sugar. Okay, so there's some difference in the type of fiber that is being used. So thirdly, for Bio7, all right, the type of fiber that we have improvised, all right, is really mainly to improve the good bacteria in the body. So there are some differences in terms of the structure of the fiber and for its use in different parts of the body. So to answer your question, yeah, there is some difference in terms of structure for these 3 things. Okay, so does Bio5 Slim or Bio7 also help cholesterol? Bio7 help for slimming. Actually, to be frank, even though, right, the core function, like for example, slim, okay, to weight loss. Like just now we see, right, testimony from Yokwah. Not just only he experienced weight loss, okay, he also seen other benefits in terms of his cholesterol and all of that kind of thing, you know. So fiber not just only, okay, strict, okay, just I will only work on cholesterol, okay. And the best thing is that it can also help to lower other things that was also within the benefit of fiber. So for Yokwah, it's amazing that he's able to also lower his cholesterol and his liver test function, everything also is able to lower down. So I would say that it, for some people they can experience even added benefit like cholesterol. So you get an extra benefit lah. If it does lower cholesterol for you, it's great. Bar 7, if you take with 447, you can also see some amount of weight loss. Yes, you can. Okay, the fiber and live fiber is very different. Okay, there are some soluble fibers, but there are a lot more other herbs and insoluble fiber. Okay, and the function of the fiber in live fiber is really towards the large intestine. In terms of how we go to the toilet, okay, it protects the lining of our intestine. So the function of live fiber is actually quite different, and you will not be able to see the kind of effect with our Bowels Life range. Yes. My mom consumes daily 2 meals with Bowels Life. Also, she takes bone fortify with live fiber. She gets constipation quite often nowadays. Could it be she has too much fiber? That could be. Sorry, I have to read again. Consume daily meals with Bowels Life. Also, she takes bone fortify. She gets constipation. Okay, I also need to know her water intake. Okay, is she drinking enough water? And how she drinks the live fiber. All right. So always, well, okay, it's good that she's taking Bowels Life and with the live fiber. I think water is one thing. Okay, and second thing also it comes with age. Your intestine don't move as much. Okay, so in this case, I would recommend for her to also periodically try our clear start. Okay, it's very important because once in a while our gut will kind of lose the ability to expel waste already. So I think for her, if she gets stuck, she should go another cycle with our this clear start 30. Then she'll be able to bring it back to rhythm again. Okay, so I need to check the time first. Okay, I still have 7 minutes. So what's the best way to measure the effectiveness of the Bowels product? Also, as a new starter, after how many months should I test? Can you please advise? Minimum at least 3 months. Okay, if you want to see some result, at least 3 months. Okay, but of course, you can't just we see the benefit then you stop taking. You want to see the effect, for as long as you can, right? So we of course advise you to take long term after that course of 3 months. Yeah. All the 3 Bowels Life, yeah, to a certain degree they do actually. Okay, but of course, S will still be more direct towards managing sugar, okay, because of the type of fiber. Yeah, but for your case, I know you have also experienced sugar benefits, lower benefit with 7. So in that sense, it does contribute. Okay, from No Hidayah, I've been taking Bowels Life Slim and change to 7, okay. But so far, it has helped me to control my cholesterol level. The problem I have is I'm not able to reduce my weight. Any advice? Okay, so this is a very, this question needs more questions, all right, after this. Okay, I also need to know how you eat, all right, how is your food intake? Do you follow the 4-4-12? Will you try to incorporate exercise? Okay, there are many other factors. And how do you eat your Bowels Life Slim? Do you take before food? So there are other areas, okay, beyond this question for us to be able to identify what exactly is the problem. All right. Okay, if I can only afford one Bowels Life, which one would be the best for sugar management? Okay, Bowels Life do manage your sugar well. I'm now no longer on medication for sugar and BP for past 2 years. Oh, that's good. Okay, you don't even take medication. I think that's great. Okay, to answer this question, right, it really boils down to what is the person's main concern. So if a person has overweight issues, okay, and at the same time he also struggle to control his sugar, then I will recommend a person to go for S. right, to lower down that weight first, okay, and from there manage his sugar. But for a person who, for example, he's not, don't have overweight issues, that person is very thin, but this person also have problem to somehow or other his sugar is out of control. Okay, there are incidences like this. So then we have to identify even further what really is the cause of this person's high sugar level. This could mean that something may be wrong with his microbiome already, okay, that contributes to the cell unable to metabolize the sugar effectively, because it's nothing to do with weight really. So if in cases like this, I would then recommend them to take 7, all right, or 7 for people who want to maintain and things like that. And ultimately, I think everybody have very different response to our products. So some people, they find it better in sugar compared to 7. And some people say that 7 is better than S. So it really boils down to a person's individual response towards it. Okay, other than that, S and 7, they do also in some way help to manage sugar levels. Okay, so right, I think this is the end of the questions. And I really enjoy answering you. I hope I'm not too long-winded. Okay, so thank you very much. I think we are reaching the end of today's session. I hope you have learned a thing or two about our core products. And next week, we will be moving into our metabolism. All right, we're going to how we can really amp up and restart our metabolic engine. So be sure to stay tuned, and we'll see you next week. Yes, next week. Thank you very much. Bye.